Hi, everyone, and welcome to the special simulcast, the Neil Haley Show and the Cutting Edge Benefits Podcast. Without Tom Quigley at ClaimLinx today, we have Anthony McMahon. Anthony, and our topic today is what are companies seeing when it comes to price for health insurance right now? It's going through the roof, isn't it?
It is. It is. I could tell you the craziest outliers and then probably tell you a
Yeah,
norm.
tell me a crazy outlier first.
Crazy outlier. I saw a case, I forget, it's either New York State or maybe Ohio. It was like $5,400 a family per month in premium. So what is that? 60,000, 65,000 a year. So that's what the insurance carrier is saying. Pay us $65,000 a year and we'll give you a $2,000 deductible. So you're still on the hook for the first 2,000 of claims as well. And then after that, we'll pick it up for you guys and we'll give you a PPO network. That's the deal basically that the insurance carrier is offering. So that's the craziest one I've seen. But I mean, all the time, I mean, we're seeing family rates 2,500, 3,000, 3,500. I mean, it's a mortgage. It's insane. We're seeing single rates 7, 8, 900, 1,000, just for one person. And they're not even on, old or anything. They're just, a young, healthy person, but that's their rate, because of the way that these companies are buying, group health insurance. It's ridiculous.
And it's absolutely horrible what's happening. I mean, the price is just and just I can't imagine those numbers. So you've can want to discuss some case studies today of how you've been able to help employers save money on their healthcare while also providing great benefits.
Yeah. I mean, we can really turn to a ton. A few that come to mind, I can. I'm trying to think of which direction I want to bring this. I'll bring it to a very straightforward model. So, company about 25 people, they're probably paying, give or take like $40,000 per month in health insurance. They had a group plan, and the problem is that when they have everybody in one group plan, there's no creativity. It's just the broker agent saying, "Hey, give me your census. I'm going to flip it over to the carriers that I'm appointed with." And basically, I always say they're going to pick the best of the worst. There's no creativity whatsoever. It's a pure commodity, and they're a pure conduit between this business and the insurance carriers. Instead, what we're doing is we're looking at the group and we're looking at each individual and saying, all right, what is the best way to present this group and their employees to the insurance carriers to get those rates down? So we go through a process where they fill out form fire health applications. We could do that pre-vetting. We can send them in the best light possible. In addition to that, we buy the highest deductible, lowest cost options to get those premiums down, 50, 60%. Use the MERP underneath to mirror or improve the benefits that they're already accustomed to. And then they self-finance the difference. And at the end of the day, end up saving 35, 40%. So that group in particular, we got them down from about 40 to 15,000 per month. So they're saving $25,000 a month, give or take, over the course of the year, they're going to end up saving 250, 300. And it's a small, 25 person business. This is not abnormal. These companies don't realize how much they're overpaying. That's why anymore with me, our team, Tom, we no longer say, "Hey, are you interested in saving?" We're now saying, "Hey, are you interested in finding out how much you're already overpaying?" Which really, it upsets some people, but it gets the fire, lit underneath of them. That's like, "Hey, like enough is enough. Like I've done this for too many years. I haven't questioned this cost for so many, years, and I'm done with it. I'm looking for something that's smarter, that's better for my company, for my people, that's going to give us long-term, growth and profitability, and we're going to finally nip this in the bud." These companies they're getting screwed, and we're really trying to get out there, preach the word, show these case studies, and show them, hey, you guys do not have to do this any longer. You have a viable alternative that's not going to hurt the company. It's not going to hurt the employees. It's going to improve everything across the board.
Exactly. Oh wow. Give me another case study.
Yeah, well, there's one that we had. They were in four different states. It was a chain of different. I don't want to say their name, but it's basically
Yeah.
a chain, and they had a few different locations. So this one was interesting. They didn't have health insurance before, but they got health insurance quotes, and the quotes were horrific, like similar matters I'm talking about, like probably $1,000 single rates, $2,500, $3,000 family rates. The group was probably 40, 50 people in total across the few locations, and instead we said, hey, why don't you, allow your employees because you're under 50 to get individual policies. They weren't very high income earners. And if you get an individual policy, depending on your household size, your income level, where you live, you get a subsidy and you can get reduced premium because of that. So the way that we ended up setting it up for them, I forget exactly where we ended up bringing them, but it was like laughable, the amount of cost versus if they got on a group plan. So for that case, we look at this is why I'm saying we treat every group in particular and specific. We don't say, hey, send us your census, we're going to send it to the carriers and whatever costs the best, you guys pick. And it's as simple as that. We say, no, what's the deal with this group demographic? Where are they located? What are their incomes? What are the dependent levels? Like everything about the group. And then we're like, all right, this is the best way for you guys to set up insurance, and we're going to show you how to do it, and we're going to do it. So for this group, we got everybody individual policies. The majority of the employees were low income workers. So their premiums got, reduced substantially. So that a lot of them ended up getting, $0 monthly premiums because they got individual plans through the marketplace, or they, had a plan that should have cost $1,000 a month and they got it for $300 a month. So at the end of the day, this company that was going to be looking at, probably 60, 70, $80,000 a month in fixed premium costs to set up a group policy for these 40 or so employees, they ended up, it was like sub $10,000 in total for premium because of the way that we bought it. So everybody then had an individual policy that was custom to them, has their doctors in network. They get reduced premium based on their specific circumstance. And then the company offers the medical expense reimbursement plans underneath to give them better benefits underneath of those individual plans. So the company makes out, they don't have to pay this exuberant, group premium. The employee work, they make out because they don't need to cost share at a super high level because the premiums are super cheap or maybe nothing at all. And then the employee also makes out because now the company can afford to give them better benefits through the medical expense reimbursement plan underneath, where, before they probably would have got them a group policy that had a $4,000 or $5,000 deductible. Now they're able to give them $1,000 or $2,000 deductible at a fraction of the cost. So that's why you need to look at every group and every employee specifically to say what is the best way for this group to get set up, and that's what we do.
So that's really interesting. And you have a bunch of those different case studies on your website as well, right?
Yeah, on the website, Tom and I post them on LinkedIn a lot. Our new salesperson, Caitlin, she also posted. So if you go to anybody on ClaimLinx, LinkedIn or Facebook or YouTube, we're always posting these case studies. We talk about them. We're happy to connect you with our clients if you want to ask them for yourself. A lot of them like bragging about it now. They like telling their friends how much they're finally saving on health insurance. So if you're hearing this and you're like, hey, my company's overpaying, my employees are not happy with it, and I don't know what to do about it, please do reach out and we're happy to, figure out what your group in particular should be doing.
All right. So go to claimlinx.com, schedule a call with Anthony and his team. Appreciate it, Anthony. That was the special simulcast of the Neil Haley Show and the Cutting Edge Benefits podcast, guys.